What is the most likely diagnosis? A 28-year-old pregnant woman at 34 weeks gestation presents to the ED with sudden onset severe abdominal pain and vaginal bleeding. Her blood pressure is 150/95 and her pulse is 110. The fetal heart rate is noted to be 160. The patient denies any history of trauma. Okay. What is the most likely diagnosis? Man. So she's in her third trimester of pregnancy and she is bleeding with a high blood pressure. And the fetal heart rate is also 160, which I would have assumed is vasoprevia. But that's my first thought was vasoprevia. I don't think it's ectopic pregnancy. Um, I don't think it's premature rupture of membranes. I don't know even, I know I've heard of that. I don't know what that is. Um, Abruptio placenta is always like um a decent answer when you're like third trimester and you have bleeding, in my opinion, and that could be
Okay.
wrong. I do bad on these, so I don't really know here. Um, placenta previa. I just didn't think it was placenta previa. There's nothing here about the like umbilical cord being like in a certain spot, so I'd probably go with abruptio placenta.
Okay. Final
Uterine
answer.
rupture. Oh, man, no trauma, no uterine rupture. I'm gonna say yes. This is probably my answer.
Yeah, this is going to be your best answer here. Okay. It doesn't give you all the risk factor, but let's talk about it, right? So ectopic pregnancy, right? Going to be kind of weird at this stage, right? As in, you're in your third trimester. Hopefully you would have caught an ectopic pregnancy way earlier, right?
Yeah.
Um, can happen, by the way. Very rare, but they're not going to test you on that, right? I mean, I think there's case reports that a baby has lived in the abdomen, right? Before, which is kind of crazy. Okay. Placenta previa, like you said, is it painful or painless?
Oh, maybe it's painless.
Yeah, painless bleeding, right? You don't get too much pain, right? It's just the placenta is right over the os. And so it oozes out some blood, painless bleeding, right? Premature rupture of membranes. What do you think that means?
I thought not, maybe I'm wrong, but my first thought is always something with like it's just the lungs are not working. Like you have NRDS. Is that wrong?
No, so you're talking about the sequelae of having a premature kiddo, but premature rupture of membranes just means that your amniotic fluid or a female's water breaks too early, right? So
Oh,
you're trying
okay.
to deliver too early, right? And so if she had symptoms of clear fluid coming out of her vagina, right, that is a lot, and she's not term yet, premature, right? So that's premature rupture of membranes, right? You're not supposed to deliver yet, but you were starting to deliver, right? That's premature rupture of membranes.
Okay.
So a woman having her water break at a premature time is considered premature rupture of membranes. Okay. Uterine rupture, right? What's the difference between abrupto placentae and uterine rupture? What's the difference there?
I think that, well, you mean like just physiologically or like causing or what do you so
Yeah, physiologically. Talk to me kind of anatomically. What's the difference? Because I know this might sound really stupid, but I'll be like, when I was studying for step one, I was just like, aren't they the same thing, right? I mean, as stupid as it sounds, but
no, no, I'm kind of in the same boat. So I would assume that abruptio placentae is literally like the placenta gets like interrupted or like they like kind of rips off a little bit
yeah,
from the endometrium.
yeah,
And
exactly.
so yeah.
So the uterus, right? So there's a separation of placenta and uterus, right? Because the placenta is anchored onto the uterus. So if you have a placenta erupta, then that is kind of ripping off that wall of the uterine. Okay. And then what is uterine rupture?
Uterine rupture, I would just assume is maybe like there's too much pressure or something, or like some type of trauma would have to be there to initiate like a breaking in like just like the uterine itself, like the uterus like spiral arteries would start to shed and stuff like that. So I would assume it's like a ripping of the uterus is kind of how I would
Yeah.
describe
So exactly, right? So I'm gonna draw two pictures here, right? So placenta erupta, here's the placenta, right? And here's like the baby, right? This is my best drawing, sorry. Okay.
it.
So abrupta placenta, right? This area is separated, right? This connection is separated, right? Uterine rupture, if you draw the same uterus, right? So let's say the placenta is right here, right? Here's the umbilical cord, right? Here's the baby, right? Right? And you actually have a rupture either through trauma or some defect of actually the muscle, right? And actually, what can happen is baby can actually dislocate kind of outside of the uterus also,
Oh
right?
man.
And so that's sometimes a physical exam finding that you find baby like in the abdomen, right? Because baby is no longer contained within the uterus, right? That has ruptured, right? And so but yeah, just know the slight differences. This would be very painful, of course, also, right? But usually followed by some kind of ridiculous like bad trauma or something like that.
Like in a car accident, and now the baby's like
Exactly.
stuck in the
It's
diaphragm, so like
floating in
something like that.
the gastrointestinal tracts, right? And so that wouldn't be very good, right? But life threatening, obviously, right? I'm trying to think, is there anything else? Oh, fetal distress is a really big one, right? Trauma history, right? And then placenta previa. We already kind of talked about, right? Placenta from the uterine
Painless
wall,
vaginal bleeding.
right? Okay. And then elevated fetal heart rate, fetal distress, right? Because now the blood supply is a little bit tenuous, right? So
Mm-hmm. Mm-hmm. Okay, that was good. That was good.